Well, good afternoon, everybody. We're just going to take a few moments while people start to come on in. It always takes a few moments for these things for people to kind of come in the virtual door, as it were. But my name is Jessie Wild and I'm from the Bristol Housing Festival. And for those of you that don't know, we are hosting a 3-week series of events and we are coming halfway through. We're just about halfway through now, our second week. If you've missed any of the webinars so far, do check out our YouTube channel because they're all kind of stacked up there. The recordings are all there ready for you to go back and watch. We've also been hosting a series of interviews called In Conversation With, and we've been able to interview some really, really interesting people. Today we interviewed the Metro Mayor, Tim Bowles, and again, you'll be able to see those videos again if you missed them, and they are all on our YouTube channel. Tomorrow we will be premiering the interview with Sangam Debonair, who's the Bristol West MP, Labour MP, and she is also the Shadow Secretary for Housing. So she has a really interesting, some really interesting things to say about the Bristol Housing Festival, the housing crisis that we're facing, our construction skills shortage, and the like. But I just wanted to welcome everybody. Welcome if you've joined since I've been starting to talk to this particular webinar, which is chaired by Zoe Metcalf. And at this point, where I think we have got most people in the door from the waiting room, I am going to hand over to Zoe Metcalf to chair this event. I really do hope you enjoy it, and thank you so much for getting involved. Zoe.
Thanks, Jessie, and welcome everyone virtually. I'm Zoe Metcalf of Value Shift, and I'd like to start by thanking the Bristol Housing Festival for creating this forum and enabling us to have this distinguished panel of experts talk to us today. They're not only experts in the field, but they're actually making things happen. Our intention is to hold a conversation for 45 minutes, after which we'll have 15 minutes of Q&A. So do post your questions via the Q&A field at the bottom of the webinar. Your engagement is key to enabling us to move conversation into action. So before I introduce the panel, I just wanted to do a little bit of scene setting around homelessness in the time of the pandemic and the current housing crisis. Nationally, more than 8 million people in England, around 1 in 7, are living in unaffordable, insecure or unstable homes. According to National Housing Federation research, there are 3.6 million people living in overcrowded homes. 2.5 million people cannot afford their rent or mortgage, and 2.5 million adults are living with parents, ex-partners or with friends because they cannot afford to move out. According to the British research establishment, poor quality housing costs the NHS in the region of 1.4 billion per year due to building related hazards. In the west of England, Bristol faces the most significant challenges at this time. In Bristol, 521 households currently live in temporary accommodation. 1,200 people are on the waiting list for housing. 956 homeless individuals are currently supported by St Mungo's outreach team, and on any given night there are on average circa 84 people sleeping rough in our city. Statistics show a rapid rise in homelessness over the last 7 years. In this pandemic, we have been seeing the migration of families and individuals to the region. House prices are rising locally, Bedminster being the 5th most sellable postcode in the UK, rising 2% in the period of the pandemic to date. Horfield is showing the highest proportional increase in house prices in Bristol over the last 12 months. In terms of rent, our average rent in Bristol is £960 per calendar month, which is circa 42% of the average earner's wage. This is second only to London, which is at 45% of the average earner's wage. Income and housing benefits are out of sync with relevant rental levels at this time. So I'm delighted that today our speakers are bringing both a local and a national perspective on the challenges, and we'll be sharing some of their key insights and learning and innovation in this period of pandemic. So without further ado, I'm going to start by asking each individual to introduce themselves. So Simon, if I can start with you, please.
Sure. Hello everybody, I'm Simon. I work for the Ministry of Housing and Local Government. I'm a specialist advisor in faith and community groups. I actually joined the MHCLG during the pandemic. Prior to that, I was running a homeless and refugee charity based in Bedford. So that's me.
Thanks, Simon. And to Paul.
Good afternoon, everybody. My name is Paul Sylvester. I'm the Head of Housing Options for Bristol City Council, so I manage a range of homelessness services. I've been working in housing and homelessness for over 23 years now, and I absolutely love my job.
Thanks, Paul. And Penny.
Hello everybody, my name's Penny Wolster. I work for Shelter, the National Housing and Homelessness charity based here in Bristol, and we have a team of legal experts, advisors and support workers who work alongside our community organiser and local campaign initiatives to bring about better housing here in Bristol.
Thanks, Penny. And to Angelique.
Hello everyone. I work in research and policy at Black South West Network, and I do that alongside my PhD at the University of Bristol, which looks to understand the role of social enterprise in the provision of housing in townships in Cape Town. And I've recently just, having worked on a variety of research projects at BSWN, but the latest being the analysis of the housing needs and aspirations of BME communities in Bristol.
Great, thanks Angelique. And finally, Johannes.
Yeah, hello everyone. I'm Johannes Lennart and I'm an academic at Cambridge, and I've been looking at homelessness mostly from the perspective of people sleeping rough for the last 9 years. And most recently, and that's what I'll talk about today, I've accompanied a modular homes project, in fact, the first of its kind in England.
Great, thank you everyone. So I'd like to start with Simon and Paul. Simon first to give a national perspective around homelessness, but also to share some of his insights and learning from his own experiences and his thesis, and then move on to Paul, and also to provide some of the learning and innovation that you've experienced in this time of the pandemic.
Great. Okay. Yeah, I mean, we certainly do find ourselves in quite a unique and strange time, don't we, in the middle of this pandemic. And we've seen a kind of response to homelessness unlike anything I've ever experienced. I think, broadly speaking, there was, when the kind of Everyone In programme was announced nationally, we can celebrate a lot of successes from that. Most local areas took on hotels and made sure that the rough sleepers were accommodated, and a huge number were. And I think there's a lot we can celebrate within that kind of Everyone In programme, not least the partnerships that were established around the hotels and other kind of accommodation for those rough sleepers. And those partnerships, you know, incorporated all kinds of different groups. So we had people from health, local authorities, obviously central government, local charities and faith groups all working together to end homelessness in a really effective and quick way. We need to make sure we celebrate that partnership that came together during that early stages of that pandemic and through the pandemic. Has just been quite incredible. So there's lots to celebrate in that. And behind the kind of thousands of people that were moved in, I always like to try and remember the stories of people that were affected. I was just speaking with a local area just this morning, and they were reflecting on someone that had been sleeping rough in their area for 15 years. They hadn't been able to engage them with any offers in any sustainable way anyway, and they actually moved into their hotel, and now they've moved into their own property, and it's the first time they've had their own property for 15 years. So there's remarkable stories that are happening across the country behind the kind of, you know, the thousands that have been kind of moved in and moved on, which is something to celebrate. And so that's a real positive, but we can't just pretend that we've solved it, that we are in a unique time. But we do know that rough sleeping numbers are starting to creep up again, and we really want to know why that is, and how we can prevent that from happening, and where we go from here. Where do we go from this Everyone In stage? And obviously there's like many facets around how we end homelessness, and I know we're going to talk about lots of them today, and we need to talk about housing, and we need to make sure support's right and the funding's there. We need to make sure all of those things are talked about. But one of the things I'm really passionate about is making sure that the community, relationships, belonging is also talked about in solving homelessness in the long term. Because I think we do need to, I don't want to detract away from the conversation about housing, because you can't solve homelessness without housing. That makes a lot of sense. But I think if we're going to sustainably end homelessness, we also need to be thinking about how we build people into community, build them into belonging, and build them into relationships. And through some research I did, I believe that comes through faith groups, and that comes through employment, and I'm sure there are other ways as well, but they can be key aspects in ending homelessness in the long term and sustainably. And I think that's a real role that local groups can play as well. So that's kind of what I'm passionate about at the MHCLG, representing kind of faith and community groups to see how they can play their part in that aspect of ending homelessness in the long run.
Thanks, Simon. And one of the things that you highlighted when we've talked prior to this event was the pull of the homeless community and drawing people, potentially back from being in a more stable, secure home. Would you like to expand on that a little bit more?
I can, and I think Johannes will be able to expand on it as well when he speaks. But yeah, the pull of the homeless community. I think for me, it feels fairly logical that we want to be around people. We're not created for isolation. We're created for community, I believe, and that is the stuff that helps sustain your life. Your friendships, your relationships. And so if you're isolated, you want to be with a community. And if you've had community on the streets, but you then get put in an isolated place, the way you're on your own, sure, you might have a great house or whatever, and that's a good part of it. But if you haven't got any friends and you're lonely, there is a huge pull back to your community on the streets, and that's one of my beliefs in making sure that it's so important that we create new communities for people, or help people be part of a community.
Yeah. One of the other things you highlighted when we talked previously was stigma, and talking about the stigma of not only yourself, being a homeless person, but the other stigmas that exist in relation to reaching out to services and experience of them. Do you want to just share a little bit about that as well with the research that you did?
Yes. I mean, I think. I think that one of the great things is about how do we kind of level the playing field between support services and homeless people, and when does a homeless person stop being a homeless person or a formerly homeless person and be able just to be a person. And I think that one of the problems with, I think, professional services is you always have that difficult relationship of professional and recipient, which is of course very important. Professional boundaries are important, but that means, I think, sometimes that a professional can only help a person so far. And so we need to, how does that person break out of the stigma of being a client and become a person within their kind of community?
Great, thank you, Simon. So Paul, can I move on to you to just provide more of a local perspective and talk about the different ways in which your housing team have been working in Bristol?
Yes, absolutely. And thanks for that introduction, Simon. That was really, really great to hear the national context. So let's start talking a little bit about Bristol. I'll start off with some stats. I think it's really important to repeat some of the things that Zoe has mentioned already, and then I'll talk to you about my experience of us working together in partnership across the sector on our COVID homelessness response. So 100 people sleeping rough on any one night is really not the sort of city that any of us want to live in. But one of the main issues with numbers of people sleeping rough is the flow onto the streets. And not only are there 100 people sleeping rough on any one night, but there are approximately 1,200 new people coming onto the streets in one single year. And homelessness pre-COVID was already very high. So as well as people sleeping rough, we had 117 people in night shelters, over 600 households in temporary accommodation. And in terms of affordable housing, social housing lettings were at record low numbers, and the private housing market was expensive and unaffordable for many Bristol citizens. And then we enter a global pandemic. So homelessness for me is a complex and multifaceted issue that requires a coordinated response from a range of organisations. And reflecting back, Bristol's homelessness COVID response has been a great example of organisations from across the sector working together with the City Council, with the challenge of providing emergency accommodation for people rough sleeping and in night shelters so that it could self-isolate. This was an emergency response and everything happened at pace. So I need to be really clear about one thing. Many clients have multiple health issues and are vulnerable to COVID. Our response was and is about saving lives. And I'm really pleased to say that to date, we're only aware of one positive COVID case in homelessness services in Bristol. It's really important to understand that in Bristol, we already had good partnership working across the sector, and during the pandemic, it's become even better. Good communication was essential, and we quickly established a sector-wide weekly meeting chaired by our Director of Public Health. Initially by phone conference, which seems very old school now, but quickly moving on to the marvel of Zoom. Many other working groups were established and focusing on a particular part of the COVID response, which then fed back into the weekly sector-wide meeting. I'm so proud of what we've achieved. One of my main reflections is how well colleagues within my service and across the sector adapted to this new environment, working together to problem solve and overcome challenges. Over 1,100 individuals housed in emergency accommodation as part of this initiative. 300 rooms in 5 hotels and hostels stood up in a matter of weeks. And accommodation provided for people with no recourse to public funds who were homeless. However, finding and placing people in accommodation was just the beginning. We needed to support people to stay in hotels and provide services to meet their needs. The response by the sector to this challenge was simply amazing. Organisations adapted their services to provide support teams in hotels for clients, in effect creating new supported housing schemes. Substance misuse services and health services delivered to people in hotels. And an incredible response by organisations providing food and essentials to people in hotels. Over 100,000 meals delivered to people in hotels and emergency accommodation by the amazing Caring in Bristol initiative Cheers Drive, which worked with Bristol restaurants and chefs. We created a social work team with a specific remit of assessing and supporting clients in hotels who have eligible care needs, and also the invaluable support of public health colleagues in helping to prevent the spread of COVID and in developing outbreak management plans. So our aim is that as we stop using hotels, the people who we have accommodated do not return to the streets. And part of the solution clearly is securing suitable, affordable move-on accommodation. That's one of our key priorities, and with the One City Move-On project, focused on sourcing a supply and range of accommodation for those experiencing or at risk of homelessness. Now, this includes working proactively with private landlords, developers and registered providers, as well as repurposing and bringing council-owned properties back into use, entering into large-scale leasing or nominations agreements, and innovative solutions including modular housing. I also wanted to mention Change for Good. Now, this exciting initiative is a partnership between Bristol City Council, Bristol, North Somerset and South Gloss CCG, and Golden Key. The aim of this initiative is to change how agencies in the city work together to support people with complex needs, starting with people who are homeless. And there is a very welcome focus on homelessness, mental health, and social care needs. There are a number of projects at early stages that will sit under Change for Good with a focus on mental health. So what next? We're still in a pandemic with cases rising. The number of households approaching my service because they are homeless or threatened with homelessness is increasing. And we expect this to continue as the economic and social impact of COVID plays out in our city. So clearly, continuing to collaborate and innovate will be essential, but there are a number of asks from government that we need to help prevent homelessness, and these are things like more funding and increased protections for people in the private rented sector. Zoe, back to you.
Paul, thank you. And that really is quite an incredible achievement for the team, and really demonstrates the power of the collective in this one city of Bristol, and in terms of moving Bristol into a city of sanctuary. So thank you for that, Paul. I'd like now to move to Angelique, please. Angelique has been working for Black South West Network, leading the research into the housing need for the BAME community. So I'm delighted, Angelique, that you're here today to be able to share this with us before you've even published it at this stage.
Thank you. So the project is jointly funded by Power to Change and Bristol City Council. And the project is aimed at capturing the picture in terms of the BME housing needs and aspirations in Bristol. The overall objective being to provide evidence for the drafting of recommendations to tackle the housing emergency in Bristol and explore potential solutions, particularly around community-led initiatives. So the project includes responses from a survey of 207 respondents, and we also did 14 interviews and 3 focus groups as well. And the project, the report sort of outlines the assesses the needs, and then goes into talking about aspirations, and then looks to looking at the role of community-led housing and addressing those needs and aspirations outlined in the previous sections. So in terms of the needs, this talks about the housing conditions. So for example, 61% of the survey's participants admitted having some type of housing issue, whether that be overcrowding, damp and condensation, coldness, disrepair or neglect. And other issues highlighted were around antisocial behaviour, financial problems, safety-related issues, and stigma. So, with regards to overcrowding, the issue of overcrowding was predominantly in the Somali households, 63% actually, and then when the issue of damp and condensation appears more generally in the African Caribbean households, which could be due to the sort of trend of African Caribbean people being owner or private renters of older houses in Bristol, so the sort of lack of access to funds for maintaining and upkeeping. And then issues such as damp and coldness and disrepair and neglect were also linked to poor quality of properties with regards to private renting. Similar issues were deemed to be affecting private and as I said, private and social households, particularly in our African Caribbean focus group. And in qualitative comments from the survey, it was highlighted how private and social landlords are neglecting their properties and not responding to the needs of their tenants adequately. So in terms of needs, I think 42% of survey respondents indicated experiencing emergency needs at least once. So the most common being sofa surfing, and then being threatened with eviction, sleeping rough, and being evicted, and also not requesting repairs due to fear of eviction. So with regards to sofa surfing, this was one of the biggest emergencies across all minority communities. Similar to the issue of overcrowding, the figure for individuals having to resort to sofa surfing is expected to be a bit higher in reality than what it is in the report. And while immigration status is perhaps a compounding factor for many, there are other contributing factors such as the universal credit system, the complexity of the housing register bidding process, the bureaucracy of social housing in general. These were all perceived as some of the barriers. So being evicted, a lot of this was quite often linked to gentrification and linked to the redevelopment of buildings turned into flats or cafes, resulting in people struggling to find affordable housing. So I suppose at its core is the displacement of the poor, and this can be difficult to measure, but our survey included a question regarding displacement and reasons for moving out of rented homes. And of the renters, 21% were directly displaced from their neighbourhood by their private landlord wanting to sell the property. Whether or not respondents have ever had to move due to rising rent prices, there was approximately 46% of respondents have either had to move or are going to move or know someone who has had to move at least once due to rising costs. So I suppose these issues all contribute not only to problems of displacement and gentrification, but surrounding concepts such as cohesion and community, and they have unintended consequences for not only the sort of the definition of community, but some of the elements which underpin it, such as organizing and mobilizing and voice and influence and health and security. So these are all factors participants felt prevented any sense of empowerment, and therefore the ability to address their own housing needs. And so these aspirations revolved around ownership due to its perceived stability and security and affordability. So moving on to the aspirations, I've drawn out a key quote out of the research, which I think sort of summarizes it quite well, which is, I don't think the aspirations of BME communities are really massively different from anybody else's. They just want something serviceable, it's comfortable, it's easy to heat, it's convenient, it's in a convenient location where they can relate to their family, friends, and access to work, and it provides the right kind of accommodation. So ownership was extremely high across all communities. So when asked to sort of classify the housing, owned housing was indicated as the primary choice at 47%, followed by council housing. And a lot of the aspirations sort of revolved around, as I said, voice and influence, and the aspiration to live in houses connected to green spaces, close to supporting facilities and infrastructure, and to be better represented in local planning and access to opportunities, and having voices heard in shaping neighbourhoods. So there's this perception that private developers build to sell with no local knowledge of the community needs or aspirations. So even when community consultation is employed, it is often becomes sort of this tick box exercise, which is largely rhetorical. So community-led housing in this way is a potential response that we were looking at in sort of countering these issues. And security for participants referred not only to sort of financial security, but to security of tenure and safety. So many discussed the pressure on housing providers to reduce cost and the impacts of that on health and safety. And participants advocated for a mindset of access when designing homes. So housing development going beyond just the home and to supporting employment, supporting access to social services and navigating the system. So we then sort of looked at community-led housing. I'm quite conscious of time now. So please do interrupt me, Zoe, if you need to. But I won't go too much into the community-led housing, but it's sort of looked at the potential for community-led housing to address those needs around the voice and influence, and designing with rather than designing for, and ownership, and the sort of, when we talk about providing access in terms of housing, the potential for community-led housing to provide that. Yeah.
Angelique, thank you. I mean, there's just such a huge breadth and depth of insight and knowledge that's just invaluable, and I'm delighted that through the platform of just this event it links you with both Simon and Paul post the event, and I know we're going to hopefully follow up with a round table to move conversations and research again into action and meaningful change. So we'll come back to you, Angelique, because there's so many. I'm sure Paul and Simon have some comments and questions and thoughts that we can pick up on in a short while. So thank you. And I'll move on to Penny, who leads the hub here for Shelter in Bristol, just to share some of the challenges and experience that you've had and lessons learned in this time of pandemic. Penny.
Thank you, Zoe. It's really lovely to be here, and I'm just reflecting on some of the things that we've heard from the participants already. One of the things that I think we've recognised across Shelter, both locally and nationally, is that the pandemic didn't create a housing crisis. We were already in one before the pandemic hit. What we've seen is that the pandemic has highlighted the issues that we had within our housing system. And we've seen some wonderful responses, both locally and nationally, to trying to move very quickly to address problems. So our colleagues within Shelter nationally worked with the government to introduce the pause on evictions, which gave many people a breathing space whilst they were struggling with their sort of changes in income and the uncertainty very early on in the pandemic. Working together with other organisations nationally and working with the government to remove the cap on local authority housing allowance levels to get it back up to the lowest 30th percentile made a big difference for some people. It meant they had more money from their local housing allowance to pay their rent at a point when they were losing income in other areas. So those are really key responses and really did make a difference. But we need to think about more, and we need to think about what happens next. And from our perspective within Shelter, the worry is that nothing seems to be coming back as to what's moving on for these both of those areas. From a local perspective, we saw a really big change in the way that we were offering our services. So we offer predominantly legal and advice services, and we would have done that traditionally in a very sort of face-to-face format where people would come to a drop-in at a central location at our hub, and we would have seen people and worked like mad to see as many people as possible, you know, within the hours of the day that we had ahead of us. Obviously, cramming lots of people into a little waiting area in the middle of a pandemic is not advisable or desirable at that point. So we moved very quickly to doing more services over the phone and to offering more advice via telephone, via Zoom, web chat, and email and letter. And to a large extent, that was very effective, but it does also bring in some issues about making sure that we're able to communicate with people in a language or a method that actually suits them. So we've seen an increase in using services like Language Line to help us with translation so that we can do conference calling with people to actually help them understand the situations that they're in. The other things that we saw, and Paul has touched on this in talking about the local response in Bristol, is actually we are not an island as an organisation. We rely very much on our partners across the wider advice sector. We rely on our ability to jointly work with other community members, and we would not be successful in delivering our legal and advice services if we didn't have those connections. So we realised very quickly that we needed to support some of those community groups as they did made huge changes in the way that they delivered their services. So one of the things that we were able to do in the first month or so was support some of our local food banks who suddenly had a huge increase in numbers of people attending them. So we sent some staff to go and help them and provided some resource just to help them make that huge change. As the change is made and they've got the resources set in, they've got the storage units for the food and things, then that resource wasn't necessarily needed in the same way, but just being able to do that and work with our local community was really powerful. From that, we also realised that there is a communication network through those food parcels that went out from across Bristol, whether that was through the Bristol City Council's food networks or through local Facebook community groups. And this is a communication network that I don't think existed before, or not as completely before COVID-19 hit. So for us as an advice agency, we felt it was really important that we worked with other advice agencies to make sure that we let people know that we were there. If you're struggling with your housing in the middle of a pandemic, you don't want to be looking through the virtual yellow pages to try and find out who the best person to talk to is. So we very quickly worked with other advice agencies from across Bristol and produced a leaflet of contact numbers and lists of what those agencies could help people with. And we sent out in the region of 10,000 leaflets through various food parcels between the beginning of May through to the end of July. And from that, we also produced some electronic materials that we were also able to share with other professionals who were doing home visits. So I think those two kind of tactics really helped us to build on our existing networks and showed a different way of working. Amongst all of that, we've had to maintain some face-to-face contact for people for whom the telephone wasn't going to work, or we needed to do that emergency contact. And we've also seen a change in the types of questions that were brought to us. Early on in the pandemic, we were seeing lots of calls from people who were trying to surrender tenancies, student tenancies, where they weren't going to be going back before the end of term. So from that, we realised that actually, rather than answering each call individually, a better way of answering those questions was to set up a renters' rights workshop together with Bristol University and offer that via Zoom. And that was a very successful mechanism to get a specific piece of advice to specific communities, but to lots of people at the same time. And we've used that model again over the summer and into the early autumn to run more of those renters' rights workshops, combining general advice about what people need to know about their tenancies, together with an opportunity to join our local campaigning work. And from that, I just wanted to talk very briefly about the fair renting campaign that we are working on. Listening to Angelique's research and the results that are coming out of that research, we can fully support that as, you know, as something that we are seeing here in Bristol. We ran a Home Truths listening campaign where we asked people to complete a questionnaire, started at the beginning of the year before we knew about COVID, and it ran until the end of August. And the really kind of key findings from the report were that conditions, disrepair, unsuitable accommodation are really the main issues that people are identifying within private renting in Bristol. Tied for that top spot is the cost of renting and the fear of a rent increase. And I think you, Zoe, very kindly highlighted the kind of average cost of rent is about 40% of people's income. For the people that we were surveying, they were saying it was 50% or more. So they're the people within the bottom section of that kind of group of our local population. And when we're moving into a climate of increased job insecurity, lack of income, or huge changes to people's income, that really does set up a perfect storm of barriers for people to be able to maintain their accommodation, and actually sends through an increasing number of people who are coming to Paul and his team at the council with looking for housing solutions, and coming to us at Shelter looking for housing solutions as well.
Thank you, Penny. It's as each of you talk, you know, that the spider's web of this fantastic ecosystem that exists here in Bristol, you know, is getting bigger and bigger as you speak, and clearly getting clearer on identifying some core areas that we can change and affect change to make this far more inclusive and accessible to everybody in terms of delivering to their housing need. So I'm going to move on to Johannes now to talk about the role of modern methods of construction in delivering housing to help support housing and rather than homelessness. So Johannes, will you share with us your research and findings, please?
Yeah, absolutely. Thank you for having me, and it's fantastic to hear particularly about all the things that are done to prevent homelessness from happening, right? I always say it's very complicated to eradicate homelessness from the perspective of looking at the reasons why people are homeless, but what you're doing is exactly going in that direction, right? For context, I'm going to report on a project which is the first of its kind in England of rolling out what is called modular homes, and these specific projects that I'm talking about concern 6 units, 25 square meters each, fully furnished, that were put in place in June in Cambridge. And I'll briefly say something about how the model as such has since been copied, or at least put into conversations in other areas, including by Centrepoint in London and by a developer called Hill, who's rolling out a similar type of model in different parts of the country. But this particular project, which was supposed to actually launch with the units in place and people moving in April, and was postponed because of COVID and the pandemic, is the first of its kind. And we were lucky enough with a team of researchers that includes people from the land economy department, as well as me as an anthropologist. So I don't normally think about contextual factors and policy. I think about the people. So the perspective that I'm providing is on this particular incidence of rolling out modular homes. What does that even mean, and what can they do, right? So as I said, there are fully freestanding apartment units of about 25 square meters that are split into what looks a bit like 3 different rooms. And there's pictures in the reports and the journalism that we wrote about this for everyone to look at. But they are very, very well furnished. They have their own bathroom and a separate living room and a fully fledged kitchen/living area with a TV. They have their own washing machine. So I always joke they are bigger than my apartment used to be in Paris, right? So they are really a freestanding unit that in and of itself, including a veranda, so an outside space, are where people moved in. And we're talking about 6 specific units that were put onto a churchyard, or what used to be, I think, just a parking space close to a church, temporarily. And that is one of the core features of these units, right? The idea is that you can put them onto a big truck, but it is still a truck, and take them elsewhere, right? Not only are they reasonably cheap, and we haven't yet figured out exactly how much cheaper than housing, but that's, as this project is coming to an end in the next 5 months, the core, or one of the core takeaway messages we want to be able to give. This is how much cheaper it is, but we can already say it is definitely cheaper in terms of construction. They're really fast to build. They're fast to take from A to B. And this is, again, one of the core features. You can take them from A to B. Once they're built, you can actually put them somewhere for a year or 2. It doesn't really make sense to just have them somewhere for a couple of weeks, because they're properly attached to the sewage system, electricity, and so on. But they're temporary kind of housing that are a possibility, or they provide a possibility to actually make use of unused land, right? That is one of the other ideas. Working together with councils, there's an option here of actually putting them where there is free space. And most importantly, and again, this is me talking as an anthropologist, they provide their own front door to the people moving in, right? The core difference between where most of these people would be coming from, which is shared accommodation, is you have your own key, you have your own space. That is a freestanding unit as such, right? What we've seen, and again, these people that are now in there, they've only moved in about 3-4 months ago, so it is possibly premature to say this is an absolute success, but what we've seen so far is that they work very well. People really like them, and often these are people that are not the most straightforward people to house. Most of them have struggled / continue to struggle with addiction issues. Their clearest and most important ask is obviously housing, but they are all coming with reasonably complex needs into the structure. So the idea was also to be able to test here whether this just works for light cases, or whether we can actually really get people in there that need support, right? And that comes with what I think is one of the most crucial kind of wraparounds to these units. They're not just housing, right? And I think, as we've said here before, anyone who claims that we can solve homelessness by just providing housing is absolutely and terribly wrong. These units come with more or less 24-hour support. So on the other end of the telephone, there's always somebody who can be there right now, right then, as well as with what they used to call a warden on site, but is actually also a person that used to be homeless, but slightly more stable, if that's a category you want to use. So in this particular case, a person that doesn't struggle with addiction needs, who kind of looks after the general state of what's going on, right? But again, everyone has their own social worker. This is continuing support that checks in with them, if not several times, at least once a week, and is on site several times a week to answer demands and answer questions, as well as provide ongoing support to be able to access specific benefits, to be access longer term housing, because again, remember, these units are supposed to be temporary for a certain number of years, as well as, most importantly, in this particular case, access to addiction treatments of various different kinds, right? And this housing plus support is the main takeaway. These units as such are not really helpful to deal with homelessness if you don't have a very specialized support provider, which is what is the case in Cambridge, right? And the other crucial thing I wanted to mention is that the different stakeholders, and we're talking many different people, right? There's people involved in constructing the units, there's people involved in financing the units, because in this particular first project, it wasn't a council. There's people involved in providing the space, there's people involved in providing this, the support. And the whole ecosystem as such is ultimately the system that chooses the people and makes sure that everything is set in place, right? All of these people need to be on board with the whole project, as it were, from the beginning to the end, right? Which is another crucial takeaway that we saw. Now, I just wanted to briefly mention the impact of COVID beyond it postponed the beginning of the units, right? I think now that there is a specific kind of system, we already have learned how it could work, where they can be produced, how they can be rolled out. These particular types of housing actually do provide a reasonably cheap and very effective means of providing quick temporary housing. And we're talking several years, right? This is not a product for several weeks for homeless people. And in a situation that we're in now, as Simon was talking about it, where quite a few councils have committed to providing longer term housing for the people in hotels at the moment, I see a big opportunity here for this actually to be a model that more and more councils in the UK and beyond that hopefully can take up.
Thank you, Johannes. I think it's really interesting also around the underused land and thinking about meanwhile use and potentially, you know, gaps in between existing houses that perhaps enable people to stay within their communities that they know, you know, that not being displaced somewhere else, which goes back to Simon's point around that value and importance of connectivity. So thank you so much for that, Johannes. It sounds really interesting, and I look forward to learning more about it and seeing more about it and utilising it here. I also wanted to pick up on Angelique's point around the inequality of access to green space and the importance of nature and health and well-being, which we will be talking about tomorrow as a separate conversation, but clearly is inextricably linked with housing. Anyway, I'll close my thoughts there. We've now got about 12 minutes left. It's an opportunity for the audience who have joined us today to ask questions. So do pose any questions that you have in the Q&A box. But whilst we're waiting to see if there are some questions that come through, I'd really like to go back to the panel and ask whether Paul or Simon would like to pick up on any of the points that you've heard today and comment on, perhaps in relation to Angelique's research, or indeed Johannes, around the role of MMC in solving homelessness. So raise your hand if you would like to make a comment in that regard. Simon's waving at me, so I'm going to move over to Simon.
I wasn't sure if there was a virtual hand button or not, so I went for a literal hand. I hope that works for everyone. No, I was just going to pose a question, I suppose. It's an interesting, or just a thought, I suppose, as it came to me about, you know, that balance we need to strike between, you know, modular housing and the quality of housing, because I think in several of the conversations I've had around the country itself, modular housing feels like such a broad spectrum of things, and so I didn't know what others' thoughts were on that, really, of kind of what level should local authorities be thinking about. You know, how long should these be able to last? What kind of quality do you think works?
And perhaps I can say, before others are very welcome to jump in here, one level of comment we had on this report was exactly in that direction. It was quite vicious, as it was on Twitter, as you can imagine. People ripping this whole project into pieces solely on the fact that these units are too small. Not having seen the units, not having spoken to the people living in the units, who are in a lot of cases actually saying, oh, this is exactly the right size. I don't want a 50 square meter council apartment because I couldn't take care of it, right? I need the support ongoing, and I don't really want a massive space, while I do really appreciate having my own front door. What I think is missing so far, and that's what we're seeing right now with some of these other projects popping up, is proper regulation of this. If this is going forward as an actual kind of building block in what we can offer to homeless people, I think we need a very specific kind of, this is what is good and fine, and this is what's not good and fine. Because what's happened, as far as I understand it, and this is all live in terms of development, is that this particular project set a precedent. There's a specific kind of square meters on there under the impression that this is going to be temporary. Now the next project basically can, and already did, jump on that saying, oh, but they're doing it, so we can do it. Right? And there needs to be, somebody needs to say at one point, okay, this is fine, this is not fine, I believe.
Yeah, so potentially this is the role of design codes, Johannes, in making sure that quality is integrated at a high and sufficient standard, so that we're not creating another problem in terms of substandard living. Absolutely. And I think that going back to your question really, Simon, that often there's a perception issue around modern methods of construction. Modern methods of construction done well often results in higher quality output, just purely through the manufacturing process and the intention from the very beginning. But Paul, you raised your hand, so I'm going to move over to Paul.
I was just going to pick up on the conversation and ask you, Johannes, about modular, and picking up on what you're saying, Zoe. Quite often people talk about modular as short-term accommodation for a limited period of time, but also I think there's a space in there for good quality modular to be homes for life, for people to live in and to enjoy. As part of your research, what type of schemes you've seen have really worked in terms of supporting the sort of cohort of people that we're talking about, people who have been former rough sleepers?
Yeah, so I'm shying away from making that argument because of this backlash that we had before, where people say, even for temporary, this is too small, this is not adequate. But a very concrete case, we have one person living in one of these modular units at the moment who's not lived, and this is going back to one of the conversations we've had before, being able to engage people that weren't engaging at all during the pandemic, who's not lived in any kind of housing beyond emergency shelter for the last 10 years. And he's now in one of these units, and he says, this is brilliant, I don't want anything else. I happily stay here. He's also quite old. I'm happily stay here as long as I'm able and allowed to stay here, right? So there's, again, from my perspective, there should be a listening going on to what people want, rather than a regulator, an agency, a support agency coming in saying, this is what we're going to do. If there's people who are very happy with staying in these housing situations longer term and being offered other solutions, so they have the choice, I don't see anything wrong with that. Who am I to say this is not okay for you? You have to go to the bigger housing. And by the way, we're cutting support, because what I'm fearing is that that's the flip side, right? For him, for instance, he will, in my opinion, and that's something very uncomfortable to say, he will need support forever. But there is no like pathway out. That doesn't happen anymore for him, I believe. And he's quite aware of that. And that's another reason why the situation that is offered to him at the moment, with a reasonably sized, very comfortable, very modern unit, plus all the support network that he needs, is actually exactly what he wants, right? And if that situation changes, great, let's reassess. But pushing a person like that into unsupported council housing is exactly the wrong thing, because that makes it much more likely to lose him again.
Great, thank you, Johannes. I'm looking at the time, we've got about 6 minutes, and Penny also raised her hand for real rather than virtually. So I'm going to move to Penny quickly now.
Thank you, Zoe. Johannes, I was just reflecting on something that you said earlier, and I think from my experience working within housing and working within shelter, I can see that these types of schemes have a place to helping some people who are experiencing housing and homelessness. But I think we need to be really honest that it won't necessarily work for everybody, in that, you know, people have as many different needs as there are people who are homeless. So actually using this as an example, for people that are living in modular housing, the next issue is not necessarily just whether they will stay in that modular housing, but where do they move on to? How do we ensure that people have somewhere else that they can move into on a long-term basis? And the elephant in the room there is social housing. It's either council-owned property or property owned by registered social landlords. And it's the fact that successively, as a nation, we haven't built enough of it over the last 40 or 50 years. So we're not going to resolve a sort of a community-wide homelessness issue unless we can address those issues that were brought up in Angelique's research, where people feel unsafe in private tenancies because they don't have security and because they don't feel able to raise issues around disrepair or raise concerns because, correctly or not, but this is how they report they feel, tenants feel that they will just be asked to leave if they're the problem person raising the issues. So yes, I think in addressing an immediate, how do we get people who are rough sleeping into something where we can work alongside and support them, this idea and this concept has a place, but it is not the final solution. It does not help the 600 families who are in temporary accommodation in Bristol, whereas actually finding a way of returning to social housing building across the country and across the Bristol area would really help with that.
Great, thank you, Penny. And I think you've been very articulate at really underpinning sort of the whole reason and being for the Bristol Housing Festival, and really trying to address that systemic issue and look at innovation, community-led housing and modern methods of construction to see how we can aggregate land and deliver housing differently. What a fantastic content today from each of you. It's been a real pleasure to listen to your insights and gain more understanding more broadly, and also hear of the significant work that's been done in the region and also nationally. Things that really struck me as key themes were around the a key element of being a humanistic in approach, that this is about thinking about individuals, and it is about creating homes in neighbourhoods. It is about wraparound services to resolve this. And I think what I'd like to do now is draw to a close by thanking you each very much, but also thanking all of you who've joined us today. I know that Paul would really like the opportunity to thank a number of organisations, which I'm sure there's so many to speak of, that have really been providing significant support during this pandemic. So Paul, I'll hand to you to do that now.
Thank you very much. So this is a really tricky thing to do because there are simply too many individuals and organisations to thank with the time that we have available. But what I will say is thank you to everyone working in the voluntary sector, whether it's around food or supporting people who are homeless, to our partners who manage supported accommodation, who've been continuing to provide services in what are the most challenging times, to the advice sector in Bristol, supporting and advocating for some of the most vulnerable people in the city. Thank you to the people who support people sleeping rough and those with complex needs, to organisations that provide floating support to help people who sustain their tenancies and resettle in their new homes, to colleagues in social care, public health and health services, and finally to everyone in the Housing Options Service. It's been a great team effort and you can all be really proud of what you've achieved. Well done. Thank you.
Thank you, Paul, and thank you to all of those organisations and individuals. And certainly I reflect, and leading up to this event, the energy, the drive, the passion and determination of all of the individuals that are involved is remarkable. To those of you who've joined the conversation today, we really want to keep this conversation going, and we do want to take action. So if you do want to be involved and you want to contribute, please do get in touch with me or the Bristol Housing Festival. As I said, we will be following up this event with more information on the Bristol Housing Festival website, and there are ongoing events and conversations throughout this week, so please do join. Again, thank you each of you for giving so much of your time and thought in preparing to today. It's been a real pleasure to have you as part of the Bristol Housing Festival. Thank you.